Okay, I think we've got a critical mass and it's 1 minute. I am a person to my word. Welcome everyone to the Inclusive Excellence Council meeting for today. I am facilitating in Dr. Romero-Leggett's absence, and so I am looking forward to the agenda and being able to make sure we make it through a few topics that Amherst has put into the chat for us, as well as hearing announcements and other updates from around the council. All right, well, we are going to start off with our land acknowledgement.
Are you seeing the swaps ones or the actual presentation?
I see both. I see your next slide and your current slide.
How about that?
Yep, current slide. And then if we could go to the land acknowledgement. Perfect. All right, would anybody be willing to read this out loud for us today? Feel free to unmute and volunteer.
I'll read it, Lindsay.
Awesome. Thanks, Gina.
Yeah, land acknowledgement. Founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia, the original peoples of New Mexico. Pueblo, Navajo, and Apache since time immemorial have deep connections to the land and have made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationships to the indigenous peoples. We gratefully recognize our history. And then do we say we encourage you to add your pronouns to your name on Zoom? Please note IEC meetings are recorded.
Perfect. There we go.
We say that at the end, but I just read it.
There you go. Perfect. Thank you so much. And that's actually a nice segue because we have you providing the EVP update for us.
All right, that's awesome. Great. I didn't submit any slides, but I do have a couple of updates that are super exciting. And I just want to give a big shout out for Helen for the last meeting and providing some updates from our office at the last meeting. And so thank you so much, Helen Maestas. You guys got to meet her. She's our Deputy Chief of Staff here in our office. But a couple of quick exciting updates for us. We are launching and are in the planning stages of an Office of Health Equity. We will be launching that. It'll be an office that'll come out directly out of the office of the EVP. That Office of Health Equity structure will have either an AVP or VP of at the Office of Health Equity organizational structure area, and underneath that umbrella will be an Office of Rural Health and an Office of Hispano Health. So many of you have probably heard Dr. Zadonis talk about that Office of Hispano Health. We are in the planning stages now. So I see Shanoa on the call as well. She and I are working closely together to plan out, starting to plan out that Office of Hispano Health. We're generating a list right now of people who are interested in giving some input to how that office will be organized. And so if you're interested in being a part of that group that will provide some input and feedback to the planning of that, please put your information in the chat, and Shanoa and I will capture that and make sure that you're involved in that. We hope to send out some kind of survey to gather some information from that larger planning group. In addition, we'll probably identify a smaller group that'll help us think through, putting pen to paper on what that structure will look like for that center of Hispano or Latino health. In addition to that, we've identified also members in the community for an external advisory group for advising us on that Center for Hispano Health. And again, if you've got nominations and people that you think might be good for that group, please reach out to Shanoa and I, or put it in the chat as well. We'll capture that as we're thinking about people externally that we'd like to involve in the planning as we're moving forward with that Center for Hispano Health. So I wanted to make sure that people knew about that. That's really exciting. Dr. Z has dedicated some funds for that. He announced that at the Health Equity Summit in December. And so we're moving forward with planning that out and moving forward with looking at that position, that overarching role for the Office of Health Equity. The second thing that's really exciting, again, coming out of the Office of the EVP, is a wellness role. And so we're just in the final stages of recognizing what that role will look like, putting out some kind of, again, VP or AVP role that will oversee a wellness center. And again, more to come on that. I think at the next meeting, I will have a better description of what that office will look like and what that job description will look like. So I'll have more to give you guys on that, but that will be overarching. There's lots of people on this call that have participated in giving input to that role and have given some feedback to us on what that might look like. But it is a role that Dr. Z is really committed to, again, moving forward with that office and hiring somebody for that role. And finally, Dr. Z, again, in the beginning stages of thinking through how do we engage better in our communities in terms of providing courses and thinking through how do we build a health sciences network within the branch campuses. So Shelley McLaughlin and myself will be meeting soon to think through a plan for how we establish some kind of networks within the branch campuses where we can, really expand on the offerings and working with each of the colleges and schools on expanding offerings in the branch campuses. So some health profession courses and really building out bigger health sciences presence at the branch campuses. So any questions about any of those initiatives or comments? Little stuff, right?
Yeah, those sound big. Those sound like fantastic opportunities. Yeah. And for the health disparities one, is that more of like an educational, a research?
The Office of Health Equity?
Equity, yes, health equity.
Yeah, the Office of Health Equity is going to be, it's going to look at all three, right? So we're going to make sure that we're inclusive of, thinking through how do we think about, we're thinking about students, we're thinking about the clinical side, we're thinking about research, right? So all of those arenas, integrated into what that Office of Health Equity will look like.
That's great. Thank you. Other questions or thoughts related to these updates?
Good
And
morning,
again,
Gina. Thank you so
good
much for
morning.
your updates. Hope you're doing well. Hope everyone's doing well. So I'm thinking these are great developments. I heard Dr. Ziadonis mention these important investments during the Health Equity Summit and, of course, during our debriefing for the Health Equity Summit. I'm just curious, are these centers new or have some of them existed in the past? I'm just curious historically which centers still exist and which ones have existed in the past and which ones are newer developments.
I'm not sure that we've ever had an Office of Health Equity. Those of you who've been here, longer than me, I've been at the university 24 years, but those of you who have been here longer than me might know more about that. I know for certain we've never had a center for Hispano Health. I know we've had pockets of work through HEROES and other programs that have appointed people to work within Hispanic communities across the state in different capacities in research or in community engagement. But I'm not sure, Dr. Roybal, that we've ever actually had a formal office like that. So, but if I stand corrected, if we have, I'd be curious to hear about the historical perspective of that and what may have happened with that.
Yeah, I recall one or a version of it in the past, but it would be interesting to look back at the history to see what we might glean from previous efforts. And then, of course, current efforts like the Center for Native American Health.
The Center for Native American Health will definitely be integrated in some way. We just haven't really wrapped our minds around how that they will be working together. But, Dr. Parker is incredibly supportive and she's got a great model for how she's been running her center. So we'll definitely be leaning heavily on her to help us guide through how we, stand up these other centers. So we'll definitely be leaning on her for that. But any information that you may have historically, Dr. Roybal, on anything that's existed, we welcome that information. We want to get it right, and we want to be able to be well informed as we're moving in that direction.
Thank you, Gina. And I look forward to collaborative efforts between the Inclusive Excellence Council and the new developments and the new investments. Thank you so much.
Absolutely. And again, anybody have any recommendations on people who are, anyone on this call, anyone who's willing to give input and feedback on as we start to grow this. Also on the external committee, I think that's really important too. You're all well connected in the community. Who are people that can help us think through what this should look like?
All right.
Thanks, guys.
Thank you, Gina. Okay. So let's see, we have Dr. Salazar going to present on the Climate Assessment Action Committee. And I think I saw her earlier. There she is. Take it away.
All right, thank you.
Of course.
Can you hear me? All right, very nice. So I am going to do my PowerPoint like this because it's just easier for me to do it this way. I would take the easy way out and not trying to figure out the PowerPoint presentation part. But this is super exciting announcement that I have to share with you all. It's about the Climate Assessment Action Committee. We will have our first meeting Monday, April 8th from 2 to 3. And this meeting is in response to the climate assessment that we did that was completed this past December and presented on. But I also want you all to begin to think about all the surveys that you've done within your own areas, or if you were aware of the one on main campus, because if you want to volunteer, you'll be bringing in all of that information. Of course, our focus is going to be on reading the reports from the climate assessment that we did in December, but of course, bring in all of the information that you have to offer. We had over 1,400 people who completed the survey from the Health Sciences Center and the hospitals, and Rankin Climate analyzed this survey. And it's very exciting to be able to talk about this and put our boots on the ground about this topic. So as a committee, what we will do is we are an action committee, and we're going to identify 2 short-term and 2 long-term action plans. So we have some processes devised to be able to hear from everybody and what actions are important to you. And then we're going to hone and narrow them down to 2, each short and long. And these actions are going to align with the Health Sciences Strategic Plan and 2040 Strategic Plan. We will be meeting virtually, and we will meet every month or every 2 months. We've not decided. And then we may meet over a 6-month period of time or over 12 months. We're going to decide this as a group once we meet as a committee. And that's what we'll be talking about that April 8th meeting. So here is who we have signed up so far. I'm showing you this slide intentionally so that if you do not see your area, your program that you're in represented, you might consider volunteering or having somebody in your group volunteer. Or if you don't see groups within your entities who have volunteered. So I'll use my entity as an example. Down here at the bottom, I have College of Pharmacy. So we have faculty who have volunteered to be on this committee, but we have no staff and no students. And so I'm going to see what we can do about representing the staff and the students, maybe getting those to volunteer. Or sometimes time is really short and maybe just needing to think of a different mechanism to hearing those voices. So maybe I'll create some sort of meetings within my own entity to hear from the students or from the staff. So be creative in how your group is represented, and all members of your group are represented. So why would you want to participate? Because this is an opportunity to serve as a crucial role to change our culture and climate. And like I said before, this is an action committee. So we are going to be identifying 2 actions that are incredibly important. A different way to prompt our brains and why we want to participate is to really not think of words, because sometimes words can be so limiting. And, when I pulled up this bit of art that I had created, it made me think of an Elton John song that said, "If I knew the tune, I just might join in." And the point of that is that each of us have a tune to contribute to this harmony that is on our campus. And each of our voices are incredibly important, our ideas, our thoughts. And so they all need to be included in developing these action plans. And so please consider participation a really important part in getting our voices heard. Here's how you can participate, and I will put this in the chat so everybody can get this. The advertisement for this did go out into HSC Connects a couple of times, so you should have received it by email, but I know sometimes searching through emails is not the most pleasant thing to do, so I'll put that in the chat. If you are interested in serving on this committee, you will need to complete this survey that you can access through this link. And you will also need to read through the executive summary and then also review the full report so that you can come informed on what it is that we need to begin to create actions on. So I'm going to stop sharing so that way I can take any questions or any comments.
Is it possible for people to participate even if they can't regularly make the meetings?
I think that that is something worth exploring. So register and then let's see what we can do. So if you're interested, don't let the meeting time prevent you. Because if we have a whole group of people or even those that say, I really want to participate, but I can't make the meeting, well, we can figure something out. Inclusiveness is truly what it is that we're after doing as much as is in our power to include. Thanks for that question. What else? All right, if you have any questions, feel free to email me or put them in the chat and we can talk about them afterward.
Wonderful, thank you, Krista. It's nice to see the progress happening, and the moving on the action components, I think, are really important. So thank you for that. Okay, we are moving through the agenda. The next up is some announcements related to our Academic Community Scholars Program application. And
I just wanted to let everyone know that the New Mexico Workforce Diversity Center of Excellence, or as you've heard it may be called the NMCOE, we are accepting applications now for our faculty scholars program, both academic and community faculty. We have extended the deadline to April 1st. I know you'll start seeing flyers go out again, maybe this weekend, HSC Connects. But if you have any faculty who you know might be interested, we really recommend that you pass this information on. Dr. Smart will drop some more information on each of them in the chat. So just to let everyone know, but I know you've all been inundated with these, but please pass it on to anybody who may be interested or you think would be good fit for this.
Perfect. So do folks have questions about that one? I know that sometimes folks are confused about which programs are available, and I can't guarantee I actually know the answers to your questions, but I can document questions and get answers to the group. I will say that I've enjoyed facilitating some echoes on mentoring for some of the scholars who have participated in the program. So it has some unique opportunities for folks that might be thinking about it, or if you know some individuals who might be interested. So a personal plug for it. Okay, next up we have an announcement about women's.
Dr. Smart, we have a hand up.
Oh, we've got a hand up. Yes, Ori.
Hi, sorry. Can you go back over just quickly who's eligible to participate in that program, the academic faculty program, community faculty scholars program?
Yeah, it looks like it's for underrepresented minority junior faculty. So that is clarified as instructor, assistant professor. This is for the academic one. They can be on any track, any college or school. having some sort of terminal degree, whatever that might be for your specific health profession. So it doesn't necessarily mean you have to have an MD, whatever the terminal degree is for your discipline. And then it defines what URM is as Black or African American, Hispanic or Latina, Latino, Latinx, Latine, Native American or Alaska Native, Hawaiian or other Pacific Islander, and Vietnamese American faculty. And then for the community faculty, the URM designation is the same, and it is someone who is in good standing at UNM HSC, who has worked with UNM learners in some under-resourced rural or urban communities. So, and I think that in the past, Amherst, correct me if I'm wrong, is someone who might have like a community faculty appointment. Is that how they usually are attached?
Correct.
And again, recognizing it's nursing, pharmacy, public health, population health, medicine, like really needing to have the full representation of our campus in the applications.
And we're also trying to focus on people with behavioral health interests as well.
Perfect. Did that help clarify, Lori, or lead to further questions? Okay.
One more hand up.
One more hand up. Krista.
Yes, I noticed that the dates to apply are passed. What are the extension dates?
So the new deadline is April 1st for submitting.
So the new deadline is April 1st for both?
For submission, so submitting your application. They will not, I don't know when they will actually be, the selection process will be done at that point, but we have extended the submission deadline to April 1st.
Thank you.
Other questions about that? I'm sure there's lots of questions, big life questions. Okay, let's keep going. We are on the announcement about our UNM Health Sciences Office for DEI Excellence Award for Women's History Month. It's happening on April 3rd at 12.
Oh yeah, I need to change that because it says 3 to 4. I apologize. It's from no, it is 3 to 4. It is 3 to 4 this time because we had a conflict. It was supposed to be this Wednesday, and we had a scheduling conflict, so we had to move it to next week, 3 to 4 p.m. But we do record all of these, and they've always been great sessions. So if you can't make it, it's always nice to watch them afterwards.
Perfect. So take a snap of that QR code now so you've got it handy and can register to attend. And remember that 3 to 4 because on the agenda it looks like it says 12. Okay, let us open it up for just any broad announcements, and then we will move on to Fabian's presentation. Anything the folks would like to share with us all, information, updates, exciting news? Deanna.
Hello, good afternoon, everyone. For those who don't know me, my name is Deanna Martinez. I serve as the director for the School of Medicine Learning Environment Office. And here sharing some really exciting news. We had put in an RPSP, or legislative proposal, to expand our office, also known as LEO, you probably know it that way, across the Health Sciences Center. And so we just found out a couple of weeks ago that the budget has been approved, and our expansion money is going to be coming forward beginning July 1st. So obviously we're really excited. We're working with Dr. Z and Gina and the deans. We're going to be putting together some planning in terms of our next steps and exactly how the expansion rollout will look. So keep eyes on that. We'll definitely have more to come, and maybe can also do more of like a formal presentation and connection with this group, so that way folks are like really keyed in. So just wanted to share that really exciting news.
Very exciting news. Thank you. We've got an announcement in the chat for folks to see. We have a Healthy Living and Diabetes Awareness Fair on April 20th, 10 to 2 at the Alamosa Community Center. And that link takes you to registration and information.
Yes. Thank you, Lindsay.
Of course, perfect. Anything else you wanted to add about it?
No, we are really happy to be able to, provide food, glucometers, and gift cards, gas cards to the community. So we are proactive on the prevention of diabetes. So thank you.
That's great. Gas cards. Sure, worth it. Other updates, announcements? Okay, well, if they come to you, feel free to drop them in the chat and we can always circle back. And then we will turn it to Fabian to give us some updates on DEI initiatives at UNM Hospital. Take it away.
Thank you, Lindsay.
Welcome.
Nice to see you. And hi, everybody. Good to see you all. My name is Fabian Armijo. I am the Executive Director for Diversity, Equity, Inclusion at the hospital. So I'm excited today to just give some updates from our office here at the hospital, what we've been up to. I kind of changed the order of my presentation a little bit, so hopefully this works, but I wanted to start out with a short, I think it's like 1-minute video of something that I'm really proud of that the Office of Diversity did, and more specifically, Millie Ledwith, who's on the call, did with her team. So I want to just play the video really quickly, and then I'll go into my slides, but I think this is a nice way to kind of start out with something that is the first step in a larger project. All right.
So I'm going to ask you some really brave questions, and all you do, if this relates to you, is to quietly stand. So my first question is in regards to this last card, and something similar to my story. Please quietly stand if someone you love has ever struggled with an addiction. Thank you so much. Please sit down. This person talks about struggling to know if someone in their family loved them. They felt lonely, they needed someone to talk to and be by their side. They didn't say anything because they didn't know what to say at the time. I am enough because, and that's scratched out. Please quietly stand is similar to some of the cards we've read today, that you've ever felt like you didn't know how to talk about what you were feeling, but you just needed someone to talk to. Thank you so much.
All right, so that was from the Go Girls Summit, which community engagement hosted. And I love watching the video. I know the volume is kind of low, so hopefully you could hear. But the questions were, if somebody you loved has struggled with an addiction, and like almost every single young woman in this group stood up. I think there were about 300 girls from different middle schools. And then the second question was, you just needed to talk to somebody about something you're going through, and they all stood up. So I play the video because it reminds me a lot of the work that I do, the work that my team does, here at UNM Hospital, because, these issues are really important. If we can help people, young people in these ages, hopefully when they get older, they won't need so many services in the hospital, behavioral health services, but we need to make sure that there's awareness, one, and then that we're doing something. So thank you to Millie and her team for putting on that summit, and I'll talk a little bit more about it in the presentation, but I thought it would be a good way to just start out. And if you couldn't hear, I see that somebody said they couldn't hear it. The volume is really, really low, but those were the two questions that were asked. Okay, let me get to my slides now. And then Lindsay, if you don't mind just telling me if you can see the presentation.
I see it and I see the slides. So if you're cool with seeing multiple things, I think it works. But now I see presenter mode.
Okay, let's see. How about that?
And now I see a slide only. Perfect.
Okay. All right. Thank you.
No problem.
All right. So I think most of you know this. This is the way the hospital's Office for Diversity, Equity, and Inclusion is structured. So we have health literacy part of the team, Native American Health Services, interpreter services, which also includes translation services, and community engagement. And then I put two little notes for myself on here. This year, we're going to start to partner with United Voices for Newcomer Rights. They were formerly, I think this organization was born from the UNM Refugee Wellbeing Project. So the staff, a lot of the staff from there have transitioned into this organization, which is what it became. And I'll talk a little bit about that through each of the slides. And then DEI education doesn't have a petal on this flower because it's been transitioned out of my office and under organizational and professional development, but there's still a dotted line to me. So I still oversee the content and stuff like that with DEI education for hospital staff. But there's a lot of opportunity in putting this this work under OPD because we can really embed DEI topics in other areas that we teach to staff throughout the organization. So everything from hiring to, tons of different things that we can, every class that they teach, we can talk about DEI. And now we have that person, Maria Bustamante, kind of putting that lens on the work that they do. So some updates from health literacy. We've started to work closer with our partners at the Health Science Center's marketing and communications team. So, there's a lot of different areas where health literacy work overlaps with marketing. So, when it comes to design and format, and there's a lot of areas where there's been kind of misunderstandings between the two teams. If something is not all of the patient education that health literacy works on is 100% on brand. So we're trying to work together to kind of figure out how do we have patient education documents that have the UNM Health logo on them that also look like part of the brand. So we're doing a lot of work there. Recently, I think last week or maybe yesterday was the first UNMH Forms Committee. So that group is put back together, which is really important because forms have been an issue and a challenge. And the Health Literacy Office is representing the larger Office of DEI at those meetings. So they're coming up with a clear process for new forms. And then, like I said, they're representing the other teams. So translation is one of the departments that pops into my mind right away, and fillable forms. So if you give a patient a form to fill out and it's translated into Vietnamese, and then they write in their responses in Vietnamese, what's the process next? So how do we get that into English? So the doctor or the nurse or whoever is working with the form can actually understand and use the material. And then new employee orientation now does have a health literacy component. So every single person that goes through new employee orientation with the hospital gets a little glimpse of health literacy. What is plain language? How to do teach back with patients, making sure they understood complex discharge instructions, different things like that. So we're really excited about that too. And all of the advanced practice providers also are going through the health literacy training. With interpreter services, we're looking at structure this year. Translate a lot of our interpreters in the department have this dual role job where they're interpreters and they're translators. But those of us who have done translation work or maybe speak another language at home or something like that, we know that speaking the language is not the same as writing. So if you haven't studied how to write in Spanish, for example, you won't necessarily know where accent marks go. Spelling can be challenging. But anyway, they're two different, in my mind, they're two different jobs. So we're looking at how do we start to break those two apart and keep them all in the same department, but separating the roles out. So our first step in that is hiring a full-time translator with new requirements. So they'll all be American Translator Association certified. And we'll have a structure with a leader over that team. So that's exciting for us. This is, I feel like jumping up and down when I talk about this one. We finally were able to hire a second American Sign Language interpreter for the hospital after 2 years of searching. So we found a fantastic person for the job. He has over 30 years of experience. He's worked in jails, which is good for us now that we're providing care at the MDC. So just a perfect fit. So we're excited about that. We went out to the MDC, to the jail, and we were asked to give recommendations on language services. It's kind of shocking what we saw that was not happening there when the county had their contractors providing the services. There was basically no language services. So we're starting a pilot to send a Spanish interpreter out there. And then we'll look at some other ways to provide video and phone interpretation there in the jail. But it's challenging because not everybody's allowed to have a cell phone on the pods where care is provided. Privacy is an issue. So we're connected with the UNMH people out there at MDC, and we're partnering on that. Increased collaboration with our partners at School of Medicine and the emergency department in regards to language services. Our educator was involved in, thanks to Dr. Rohan Minkaris invited us out there to give a talk to medical students and APPs, or I think the physician assistant students. And then there's been some work with the emergency department that we're really excited about. So hopefully we can do more of that. That's really exciting. And then we've started to pilot discharge instructions with the APP team in Spanish. So what we've done is figured out a process. We've been doing this for a couple of months. Soon we'd like to sit down and pick some metrics to see, how outcomes are affected, and hopefully they're positive for patients who've received these discharge instructions in Spanish. So those are all a couple of updates from the language services realm. This is just an interesting slide. I won't spend too much time on it, but when we looked at our numbers from last year, 2023, these were the top 15 languages requested here at UNM Hospital, Lomas campus. So what you don't see are so these are all from our vendor. So you won't see like American Sign Language on here. Also, the patient population is smaller, but it's pretty fantastic and exciting to kind of see these languages like Arabic, Swahili, and Mandarin Chinese moving up in our top 15 languages. So more people coming from those parts of the world to us. And then again, we have Dari still up there, and Navajo. And Navajo, we do have that over our video services too. So anyway, this is just kind of a glimpse of what our patient demographics look like in regards to preferred language. And then you saw the clip from Go Girl. So that was one of the things that the community engagement team did last year. And here's a picture of the team. We published our Bernalillo County listening session summary. So that's published on the county's website. So that's just, kind of the top issues that came up that we learned from our listening sessions in Bernalillo County. And then we've formed 2 health coalitions. One is called Juntos para la Comunidad, and it's conducted entirely in Spanish. And Lizbeth and Millie really lead that group. But, we've started to work on things like our patient financial assistance and hearing what patient experience is like, and then can take that into the hospital and start to make things better for patients who don't speak English. We have the Black and African American Health Coalition that Nicole Bedford is leading. So we're really excited about that. We're learning a lot from the community. The health needs assessment for the hospital is scheduled to be published soon. Hopefully next month, it'll be up on our website. We're busy planning Pride with the LGBTQ collaborative. Vote ER, and this is another thank you to our partners at the School of Medicine. Thanks to partnership with them and Millie's team, we registered 130 people to vote last year. So we will be doing that again in August, but every year we register more and more people. We're offering financial assistance trainings to the community in English and Spanish. I showed you a video from the Go Girl Youth Empowerment Summit. Every year we host a cold weather event. So this year the team gave out 700 emergency blankets to 20 different local organizations in town, places like Healthcare for the Homeless, First Nations. They came and picked up some of these blankets in preparation for the colder months for people who aren't housed. And then 180 vaccines were given at one of our health fairs at Eisenhower Middle School. And then we were part of a larger event, other groups for World Refugee Day. So 700 attendees. So excited about that, to be a part of those things. And then just a couple of updates from Native American Health Services. We will continue to do our tribal community outreach. So we start with the Pueblos and we try to organize with Navajo Nation. It's such a large community, so we have to figure that out, kind of break that into pieces. We'll be visiting the Apache Band's leaders this year too. And I'm excited because we'll be inviting people, our partners from Sandoval campus and the Cancer Center, to join us on these efforts. So if people have questions about those hospitals, there's somebody right there to take notes and take the questions back and provide answers. Tani Pecos, our manager of Native American Health Services, attends every single all public council of governors meeting. So that's really important to us. We've built better relationships with the with the Pueblo leaders through that. And I put a little winky face on this one. I don't know if people knew this or not on the call, but about 18 months ago, we transitioned the Native American referral work out of Native American Health Services and embedded that into the appointment center and advanced access. The thought behind that was they have a standardized process. They're very efficient. They have 100 people, I think, over there, more or less. Let's give them this work so that it can fit into their streamlined process. Well, it didn't work because Native American referrals, and when you're working with the Indian Health Service and the 638s, there are different processes that have to be done, and they don't always fit into a standardized process depending on the community. So that work's coming back. So we're taking back that work, and we're growing the department. So we're going to double the amount of people who work and process Native American referrals. And that is, in my mind, the best way to prioritize these patients. And that is part of our 1952 federal contract with the main hospital and Lomas campus. And then our liaisons will be doing on inpatient rounds. We got a new ad hoc form in Cerner. This also helps us make sure that we can track productivity and that our team is checking on Native patients when they're admitted to the hospital, making sure they're aware of our resources, and then we can track the productivity on that. And then, of course, the community outreach, like health fairs and things like that, and our Heritage Months will be starting to plan again. So this is a dancer from Jemez on the slide here, doing the Eagle Dance. And then these are just some of the different events we had. We've got some ribbon dancers from the Navajo Nation, the Zuni Pot dancers, and then again, we've got Cloud Eagle from Jemez, the families from Jemez and Zuni. And that picture on the very bottom left is was taken at the Sandoval campus last year. So those are just some of my updates. I'm going to try to stop sharing my screen. And I'm happy to answer any questions if there's anything that anybody wants more information on.
Outstanding events and engagement that you all are doing. Thank you for sharing that.
Sure, thank you. And thanks for having me. I'm glad to have presented. I think I was on the schedule a couple of times, so happy to have presented today.
I'm busy planning all those events.
Yeah, there we go. That's the reason.
What folks have questions or things to add?
And Fabian, fantastic presentation. Really enjoyed that, and the number of languages was really striking to me. And I'm glad to hear that you're engaging the Cancer Center in the visits with the Native American communities, because as you may know, they have a very strong interest in supporting the Native American communities and some funding to reactivate the genomics research. It's a very gentle approach to these things and really requires a lot of consideration of the community's desires and so on. So I think it's great to do this in tandem. So thank you.
No, thank you. And you know, we get a lot of questions about that when we visit with the when we're in the Pueblos or Navajo Nation or the Apache areas. So yeah, we're excited to have that partnership too. I think it's really what we needed to do. And Krista, I see a direct message, but happy to present. Let's just connect and we'll figure out a time for me to, or somebody on my team to go and chat with that group.
Fabian, I'd like to thank you and your team for your commitment. We appreciate the partnership. You and Millie and Nicole and others are constantly involved in a variety of community engagement initiatives, as well as the celebration of various Heritage Months. So we're grateful for everything you all are doing, and I appreciate the impressive presentation.
Thank you. Thanks for being such a great partner to us.
Francisco, go
I just
ahead.
wanted to say that the
Oh, no, you go.
Yeah.
50523. Well, Francisco, go first, and then we'll have 505. I don't see the name. 238-372. Go.
Oh, good afternoon, everyone. Thank you, Fabian. Great presentation and awesome work in the community. I have a quick question with respect to the listening sessions that were conducted in the different parts of the city. Where are we at in terms of, or where's UNMH? I'm sorry, UNMH at in terms of getting back to the community with the questions or the interests or the needs that were identified?
Yes, and thank you for being such an important part of that work, Francisco. We have a draft of the CHNA, which will be going to our communications director, and then it'll go to Kate. So we've got a draft, and then we're working right now on the community health improvement plan. And Dr. Anthony Flegg is kind of working, well, he is working with me to help put together strategies that we think we're confident we can deliver on and that makes sense and that meet the needs. So it's still in process, but that should all be published by next month. In April, it should be published. So for sure by May 1st, that will be up on our website at the very latest. And I think I'll just add, there's, we finished the sessions with the county. There's other areas that we need to meet with, and I think that Millie and I will continue to have conversations about what other groups can we meet with and talk to. One group that comes to mind are people who are differently abled or disabled. There's a lot of perspective that we need to hear in the hospital when it comes to not just ADA compliance, right? But, when I think of our hospital, we have a huge ramp that goes from the BBRP to the old part of the hospital. And if you're older or if you have trouble walking, like parking and then climbing up that ramp and then getting lost and then trying to get to your appointment, like we need to figure out, ways. We can't I'm sure we can't just demolish the ramp, but we've got to make sure we have people that can say, hey, you can avoid that ramp by taking the elevator, go to the second floor. So working with our volunteer services to kind of make sure that people know that and they're looking out for that. But we only learn those things by hearing from the community, right? So, and I think the other day I was in a meeting and we're talking about the new tower and we're so excited about our new tower and all these sky bridges. But then I think, yeah, now you've got to walk from another building on a sky bridge to get to hopefully not the third building where your appointment's at. But anyway, there's more work to be done. But to answer your question, yeah, we'll have everything published on the website in the next few weeks.
Thank you. Yeah, and that was a pleasure partnering with you guys. So thank you.
Thank you.
Hi, Anastasia Romero here, Master Public Health student. I just wanted to give kudos for the letting us know about the health literacy training for new employees that came up as a topic of conversation in our graduate level health communications class. And we were wondering if that was something that UNMHSC has done or had instituted. And so it's exciting to hear literally the next day that that's something new that you guys have started. So glad to hear about that. And I will definitely pass the word along to our class. So thank you.
Please do. We've had a health literacy office, I think, since 2007, but it was not a part of the new employee orientation. And we've had trouble getting people to sign up for the courses around talking to patients about, in plain language and the whole document process. So we would love to have people take the courses. So happy to connect afterwards and find a time where they can come and give a presentation or get feedback or anything. So thank you for that.
I'm going to sign up, Fabian.
All right. I'll look for your name on the roster. That'd be fantastic. Yeah.
That's like public pressure here, and it's recorded. No, really will. I mean, I think I was just thinking how integral that component of language access and also health literacy. Just walking around our department clinic, there was somebody who was confused about how to get to either family medicine or behavioral health, and it was clear that I needed to access language services actually to be able to understand the question and be able to direct them to the right place and how to do that, and the proper way to kind of engage in that interaction is, I think, a really valuable one for just all of us who are in health spaces where a patient might just walk up to you and have a question.
No, I think, and a lot of times, unfortunately, people have said, well, health literacy sounds like a fluff course or like a nice to do thing, but I was reading in the patient safety portal a concern that came up about a patient who lost her transplanted kidney. So, and she lost her kidney because she hadn't been taking her prednisone. So I think, and I don't know, there are probably other pieces to this, and I'm not a physician. I don't claim to be, or, by any means, but did the team ask, or did they make sure that they said, what are you going to do next? How are you going to take care of this kidney? Tell me in your own words how long you're going to take prednisone, because then maybe the patient wouldn't have lost that kidney. And it's really a big loss, right? Because you get on the wait list, you have to have surgery, then you get your kidney. And I think they're taking like 30 medicines. I'm looking at you, Krista, to be honest here, but they're taking all these medicines, anti-rejection medicines, and then to lose it over one pill that you could have been, you were supposed to be taking, is a really big loss. And I think health literacy is at the very least a component of helping patients have better lives and outcomes after the hospital. So yes, we would love to have more people take that course. And I know the health literacy team is super excited because they've been in conversations with a team of nurses from the Albuquerque Public School Systems, and they just want tips on how do they create documents for students that are easy to access and understand, that they can then take home. So that work's also kind of going out into the community now too. But yeah, thank you for the interest. I'm excited and happy to bring them to one of these meetings one day too, to talk if that's of interest.
Any final questions for today for Fabian? Because we can always reach him by email. All right. Well, thank you again for that presentation. I think that takes us to the end of the meeting, unless I've missed something, Emma. So unless there is any other updates or announcements that have come through, or folks that joined a little bit late who might have an announcement for us, feel free to unmute. All right, well then let's plan on calling it a meeting. And then if you, always just a reminder, if there's questions or topics or things that would be helpful to hear about in the space. I know one that we'll circle back to at some point, and Amherst we'll talk with Dr. Romero-Leggett, is what's happening with DEI offices across different parts of our country, and I think that it's probably something on folks' minds, and so we want to create some space here to talk about it, and we're kind of gathering information and getting some pre-information just to make sure that we have a constructive, supportive space for folks to think about that. So that is definitely on our top of our list to talk with Dr. Romero-Leggett around this meeting space. And I see, Krista, you have your hand raised, so you might have one update.
Yes, I don't necessarily have an update, but it was related to the announcement you made. And I just want to just send out a word of affirmation to all of us. I think we are doing amazing work, and I certainly don't want to overstate what it is that we're doing, but I also don't want to understate the work that we're doing and the coordination and the collaboration that is happening within this group. I know that we are incredibly busy, and so to come together in a meeting and share information and share each other's space is really, I feel like I just want to honor it with the greatness that it has.
Thank you. Those are perfect final words. We appreciate that, Krista. Okay, well, let's call it a day. You got 5 minutes to transition to your 1 o'clock or maybe more, but thank you all for being here. See you next time.